Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio with Dr. Douglas Rex. He's joining us here as Distinguished Professor Emeritus at Indiana University School of Medicine and a full-time clinical gastroenterologist at Indiana University Hospitals. Going to talk about colorectal cancer, or CRC, how it's rising in younger adults and underserved communities. He's going to talk about the importance of CRC screenings that are recommended for anyone 45 and older. And also, he's going to talk a bit about the survival rate if detected early. Welcome to Health Professional Radio, Dr. Douglas Rex. Thank you so much for joining us.
Great to be with you, Neil.
First of all, let's talk a bit about colorectal cancer and the importance of colorectal cancer screenings.
Sure. Colorectal cancer is the third leading cause of cancer death in both men and women in the United States, and it's probably the most preventable cancer. So the word screening has a special meaning. It means that you get checked even if you don't have any symptoms. You feel fine, but you decide to go and get checked. And when this check is done, when the screening is done, there's the opportunity to catch cancer before it has developed or caused any symptoms. And then secondly, you can find things called polyps in the colon. They grow on the inner lining of the colon, and they have the ability to turn into cancer. And if they're found and removed, you can actually prevent colon cancer from ever developing. So really, there's a tremendous burden from colorectal cancer, and the great majority of it is preventable through screening.
Are there different types of screenings for colorectal cancer? You mentioned identifying polyps. Talk about, I guess, the go-to when it comes to screening.
The go-to is colonoscopy, which is this one where you take a bowel preparation, some laxatives, and get all cleaned out. You go to the gastroenterologist, usually is the one who does it. You get a sedative medication, so you're nice and comfortable. The current sedatives, you can't even really tell what's going on. The doctor goes in and really, without disturbing the structure or function of the colon and rectum, they can check the entire thing. It's also called the large bowel. Check for these polyps, remove them, wake up, go home, feel great. And that is the most commonly used one because it's the gold standard for detection. It's the best at detecting cancer, and it's also the best by far at detecting precancerous polyps. Plus, it allows you to both detect them and remove them in the same session. It's not the only way that screening can be done because some people, we want everybody to get some kind of screening done. Some people don't want to get a colonoscopy. For those who don't want to take that preparation, don't want to have this test, then they can get a stool test. And there are two of those that are commonly used. One is a test for blood called the fecal immunochemical test, and the other one is a test for both blood and abnormal DNA in the stool. And that's the Cologuard test from Exact Sciences that you see advertised on TV quite a bit.
Screenings are recommended for anyone age 45 and up. Is that a new recommendation?
It used to be age 50. In about 2018, we saw the first recommendations to move it down to 45. And that's because for people over the age of 50, the incidence, the number of cancers occurring per unit of the population is going down. But in younger people, it's been going up. And this has been going up for several decades. And it got to the level where it was decided to move the age to begin screening down from 50 to 45. So for everybody now, age 45 and older, screening is recommended.
The CDC estimates that 1 in 5 adults between the ages of 50 and 75 has never been screened. Is that now between the ages of 45 and 75?
Yeah, it's probably even a little bit more than that. It's more like 30% of the eligible screening population is not up to date with screening, and at least fifth have never been screened. And it's too bad because screening for breast cancer and cervical cancer, those rates in women are actually higher than the rates of colorectal cancer screening for men and women combined. But actually, colorectal cancer screening is more effective than either breast cancer screening or cervical cancer screening. So it's complex why people don't get screened, but we would sure like for everybody to take advantage of this opportunity for prevention.
If there's one thing that the pandemic did show us, among many things that it revealed to us, was disparities in healthcare when it comes to certain specific groups who are at risk for certain things. When it comes to colorectal cancer, are there some specific groups that are at an increased risk for colorectal cancer?
Yes, there are some differences between racial groups in the United States. So the highest rates of colorectal cancer occur in African Americans and Native Americans, and then whites, and then after that, Asians and Hispanics. But I think the key is that the rates are high in everybody, but they are high particularly in African Americans, and unfortunately, rates of screening are lower in African Americans. So African Americans get more colorectal cancers, they get them at a younger age, and they tend to present at a later stage because fewer African Americans have undergone screening.
Is there some reason that people don't get screened? Let's say everybody got screened. What would the survival rate be?
Well, cancers that are detected by screening, about 80% of them are curable. The chance that you're going to die from colon cancer depends on the stage at which it's diagnosed. So stage 1 and 2, where it's confined to the wall of the colon or rectum, the survival is 90% for stage 1, 80+% for stage 2. Once it's spread to the lymph nodes, stage 3, the survival drops down to about 60%. And stage 4, when it's spread to a distant organ, most commonly the liver, then the survival really drops dramatically. So these high rates of death are because people often have not been checked or haven't been checked for a long time, and they have a cancer that presents at one of these later stages. But the other part that's really powerful about undergoing screening is that there's this chance to detect polyps and remove them, and thereby just prevent the entire process. The cancer never even gets started in the first place. And because screening has been recommended in people over 50, that's part of the reason over the last couple of decades for older people, we've actually seen the incidence of colon cancer dropping by about 3 to 4% per year over the last 20 years. Unfortunately, it's going up in people under that age.
With so many positives, associated with screening, why don't people get screened? And then tell us where listeners can learn more.
Well, I think there are a lot of reasons why people don't get screened. One of them is that everybody's heard about the bowel preparation, and it seems very inconvenient. We now have newer bowel preparations that require drinking less active ingredient, less kind of nasty tasting liquid solution. We also have a pill preparation that's available. So if you're interested, or when your doctor orders a colonoscopy, ask for one of these easier to take low volume or tablet preparations. Another reason is that people just don't think they're at risk. They don't appreciate that just because of their age alone, and even when you have no symptoms, that you're at risk. Another reason is the topic itself. Some people, just don't like to think about things having to do related to the bowel because it involves the toilet and poop. But, it's just a reality of life. We all do this, and we might as well talk about it freely. There's a lot of information you can get from a variety of websites. I recommend going to the American Society for Gastrointestinal Endoscopy, ASGE website, or the American College of Gastroenterology website. There's information on there for patients. A lot of good websites and information where you can learn more.
Doctor, it's been a pleasure speaking with you. Thank you so much for giving us this information. Hopefully we'll have an opportunity to speak again. And once again, thank you so much for your time.
Appreciate your interest in this topic, Neil. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Douglas Rex. Audio copies of this program are available at hpr.fm, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.